Hi everyone, today we are discussing about testosterone replacement therapy in men as well as female. So what is testosterone? The male hormone, that is sex hormone of a male is known as testosterone. Sex hormone of a female is known as estrogen. It is easy to understand the sexual cycle of a female because females have a wonderful thing that is known as a menstrual cycle. A lady even at the age of 50 years is having a regular menstrual cycle. We know that her ovary is working normally. Usually after 51 years, females enter a menopause where they cease to have a menses. Some females come with extreme heat in the body, hot flushes, urinary atrophy, breast atrophy and osteoporosis. At least we know a 30-year-old lady having regular menstrual cycle and normal breast development, we know her sexual cycle or sex hormones are normal. But for men may be looking normal, healthy outside. But we never know what about their penile length is there, whether their sexual libido is good, whether their erection is good, whether they are having adequate hair growth or their breast is enlarging like a female or not. So female hormone is easily understood with breast development and menstrual cycle. Men may be looking externally muscular, but internally the genitalia or erection or the virilization may be poor. So the male sex hormone is known as testosterone. Suppose any guy, older guy above the age of 18 years thinks that his sex hormone is low. What are the symptoms of low testosterone in men above the age of 18 or 20 years? Number one is decreased libido or sexual drive. So second is decreased hair growth. Suppose a guy is shaving his hair, they're shaving anytime, once in a day or once in 2 days. After 2 or 3 years, he's thinking that he doesn't have to shave every day. His hair is growing very slowly, once in 2 weeks or 3 weeks. That's also an indicator that the testosterone is coming down. So number one is decreased libido, decreased shaving frequency, decreased erection. He is having libido or having intercourse with the partner, but the rigidity of the penis is not good, and decreased muscle mass. People go to the gymnasium, they think that they are going for six-pack, they are exercising, but the muscle is coming down. Second is increased fat mass. Their body fat is increasing or breast is increasing or the concentration or muscle tiredness is always there. These are the symptoms of decreased testosterone in a guy above 18 or 20 years. A female, I told you, with low sex hormone have lack of menstrual cycle, extreme hot flushes, urinary atrophy, osteoporosis, but men hardly have symptoms. What are the symptoms or what are the clinical features of decreased testosterone in a guy? Decreased libido, erectile dysfunction, decreased volume of ejaculate, decreased muscle mass, increased fat mass, and poor depressed mood, cognitive dysfunction, that is memory loss, and anemia. So any guy who has any of this symptom, decreased libido, sexual drive, erectile dysfunction, premature ejaculation, decreased muscle mass, increased fat mass, or decreased mood, or you are going to gymnasium where your energy is not good, you have to check the male hormone of testosterone. So how much testosterone is required in a normal guy? How to check that? You go to any lab before 10 o'clock in the morning, that is in between 8 to 10 o'clock in the morning is the best time, and ask for a total testosterone level. It can be done just like thyroid or the 3-month average of sugar, HbA1c. Any guy can go and ask any lab person to go and do a thyroid test or a testosterone level. Total testosterone more than 3.5 nanogram per ml. That's the international cutoff. Look at this value. So this is the normal range. Normal total testosterone is more than 3.5 nanogram per ml. That is normal. Whenever your total testosterone is less than 3.5, that is known as hypogonadism. That is written here. Just like thyroid is low, that is known as hypothyroidism. When your total testosterone is low, it is known as hypogonadism. So whenever total testosterone is low, you go to an endocrinologist, repeat the total testosterone or the free testosterone with total testosterone and check the other hormone, that is FSH, LHL, prolactin, to know what is the cause of low testosterone. It can be a problem with your testicles. This is your testicles, that in English colloquially you say balls or testicles, which produces testosterone, or it can be a problem of the master gland of the body. That is in the brain, the gland is known as pituitary. So a low testosterone less than 3.5 is always says to have a hypogonadism, but don't get treatment immediately. Go to an endocrinologist. After 3 weeks, repeat the total testosterone with free testosterone, FSH, LH, prolactin. Find out what is the cause, whether it's a testicle problem per se or a pituitary problem, and start treatment with testosterone. So testosterone replacement therapy is known as TRT. That can be done in 2 ways. You can take testosterone orally as testosterone capsule. That is known as Andreol Testocap. That is available. So this is the Andreol Testocap, international brand that is available throughout the world in dose of 40 milligram tablets 3 to 4 times per day. It can testosterone slowly only increases when you take the capsule. It increases by 3 to 4 months per se, or testosterone can be taken as injection mode. Now throughout the world, injection of testosterone is preferred. That injection of testosterone, that is available throughout the world, international brand, is known as Nebido or testosterone undecanoate. So these are 1000 milligram injection of testosterone which is taken once in 3 months. So basically understand, whenever your body is not having a hormone replace, that is known as testosterone replacement therapy, that is FDA approved throughout the world. That is, suppose your body is not having insulin, you can take insulin. Suppose your body thyroid is not producing thyroxine, you can take thyroxine. Suppose your testis is not producing testosterone, either due to the problem of the testis or the pituitary problem, then you can replace with injection testosterone or capsule. Second is supplementation. Supplementation is where your body is normally having, but you are going to gymnasium, you want to increase your muscle or sexual function, there you are supplementing. Supplementation is not at all approved by US FDA. It is only replacement of hormone that is approved. Why did I give emphasis? Many guys come and doctor, my sexual function is not good, I am not having libido or sexual drive, my erection rigidity is not good, I am having premature ejaculation. And many people take only one drug, that is Viagra. Your sildenafil or a tadalafil, Cialis they take, and left right use it. Many 50% may be having low testosterone. You give them 2 injections of testosterone, the libido comes up and their erection comes up like anything. So understand the concept of testosterone. Check your testosterone before 10 o'clock in the morning, less than 3.5 nanogram per ml. It is size of hypogonadism. Go to an endocrinologist, repeat a free testosterone with an FSH, LH, prolactin, and find out what's the cost and start replacement. So you should ask me, doctor, how long to take testosterone? There are 2 types of people with obesity, people who are over fat, and people who are having poorly controlled diabetes, people who are having liver disease, kidney failure, arthritis, or chronic steroid medication. These people can have temporary decrease in testosterone that can get normally corrected after 2 or 3 shots of injection. Whereas remaining 50% of the people have an andropause. Just like menopause occur in lady, they have a testosterone that comes down with age above 40. For them, testosterone can relatively be safely taken till the age of 65 years. And what are the precautions before taking testosterone? First and foremost, check your testosterone. Second, go to an endocrinologist who is an expertising or who is used to giving testosterone injection or capsule. Then take his opinion and start. But before starting testosterone, check your 2 values, PSA for your prostate and PCV for your packed cell volume. So your PSA is more than 4 nanogram or your PCV more than 52%, don't start testosterone. But these high PSA, PCV high occurs in only 2% of the people. Otherwise, testosterone is always relatively safe till the age of 65 years. What about testosterone replacement in ladies? US FDA has approved testosterone replacement in minimum quantity for ladies right from the age of 2014. So we know that the female sex hormone is estrogen. Then why do females take male hormone of testosterone? Now the studies have shown that post-menopausal ladies after 50-55 years after menopause who are having decreased libido or decreased sexual drive and decreased quality of life, every time tired, they go to the gymnasium, still their muscles are not increasing. So these are the 3 indications. Post-menopausal ladies with decreased libido and poor quality of life, every time depressed and decreased muscle mass. For them, in addition to estrogen, you give low dose of testosterone, they have a dramatic improvement in libido and muscle function and mood. For them, we don't give the adult dose of a male of 1000 milligram. No. For them, a 50 milligram injection of testosterone once in 6 months is just approved, or androgen tablets, or adrenal androgen tablets, DHEA of 25-50 milligram is approved. Now, Tibilon tablets, that is synthetic estrogen with progesterone and androgenic act, that is known as Tibilon or Livia, that is also approved in females till the age of 55 to 60. So basically understand, hormone replacement means your body is not having hormone, you are replacing. A female is not having estrogen, she knows it by hot flushes or the age of 50 years. Men never know their hormones. Men look to be macro outside, but their penis may be small, erection may be poor, muscle may not be there, ejaculate time may be ejaculating in 10 seconds or 20 seconds. For them, they need to check the testosterone. If it is less than 3.5, go to an endocrinologist, take testosterone injection once in 3 months or a testosterone capsule. Now in India also, testosterone gels are available or testosterone patches are available. Even in ladies above the age of 50 years, postmenopausal ladies with decreased libido, sexual drive, decreased muscle mass or poor quality of life, every time tired, depressed, low dose testosterone injection 50 milligram once in 6 months or a DHEA tablets or Tibilon tablets that is widely available Livia can dramatically improve the mood, libido, quality of life and even correction of osteoporosis. Friends, this is in summary about the estrogen and testosterone. More important, I have given to testosterone. Next part we will discuss about estrogen. Thank you.